So, changing again, Stefano Fatelli,
amministratore delegato di Cantabria Labs.
CEO of Cantabria Labs di Facupa.
Innovating and using our entrepreneurial skills to build a better and healthier future together. For you, for us, for everyone. With our optimistic and nonconformist spirit, we seek out solutions in science that help people achieve the best versions of themselves and celebrate life. Whether by inventing or discovering new ingredients and patents, or through partnerships with leading international institutions such as MIT and Harvard. Our goal is to find solutions to meet the needs of healthcare professionals, ensuring maximum quality standards and evidence-based efficacy. But innovation doesn't only come from our R&D programs. It also comes from the expertise, commitment, and aspirations of the people who make the Cantabria Labs family around the world, spread across our 5 subsidiaries and with headquarters in Spain, Italy, France, Mexico, Portugal, and Morocco.
Si è tagliato.
Buongiorno a tutti.
Buongiorno.
Good morning, everyone. Welcome.
Anche la vostra è un'azienda particolare.
Yours is quite a peculiar company too, if I can say that. You're a a Spanish group. Maybe you might want to tell us something about yourself, because I believe it's quite interesting. Your group might not be that well known in the sector. We are a family-owned pharmacy business. At the beginning of the 90s, the dermatologist and the pharmacy had a view that was pretty distant of regarding skin. Well, cosmetic was at its dawn, and the dermatologist only prescribed drugs, medicines. So we decided to create a new product, but with the medicine-based approach. So all our products in the channel are pretty well studied, whether medicine for psoriasis or a supplement or a cosmetic product. We have produced a report regarding its effectiveness. So based on this principle, which is the approach the company has to all the categories of skincare products, is a very strong approach. If we consider dermocosmetics at pharmacies 1.7 billion, as a matter of fact, that is our own scope of action. That market is one single market, whether it comes through a pharmacist, a nurse, an aesthetic surgeon, or a dermatologist. That's a market that begins and finishes with all the regulatory categories we can bring to the consumers. That's not really innovative, but when we consider Europe, companies that have the same model and that bring and take in all the different skincare categories, well, they are not really that many, not even 5 in Italy. So there are, however, companies that start from pharmacies and get to a cosmetic product. And what about Italy? How did you settle in Italy? Well, first, we have 275 million sales this year with a specific growth goal. In Italy, there was a company that was a small part of a great multinational, Cooper, with brands like Avène or Oral-B. We acquired this small branch, and that was the starting point of the Cantabria Group in Italy. We have a philosophy on the company. Again, nothing is new, but we are really people-centered. We do everything together. We are a group that is characterized by strong participation. In almost all countries, we have acquired either external companies or our own distributors, and the community of these companies within the single countries have taken part in the evolution of the group. We are a strange multinational, so the local is as important as the central one, and the local brings in innovation to the group in a very leveled way. It's a nice place to work. And main countries, apart from Spain, Italy, Mexico, Portugal, projects in the US, Northern Africa, and we are launching a project in Central America. So, currently you are within the pharmacies. What is your possible evolution? How is the channel changing? We talked about that before with Hippocrates and Navide. How is this segment changing? Well, the fundamental data for me is that 50% of the Italians say that they buy if they buy cosmetics in the pharmacy, it was because they were advised by the pharmacist or the cosmetologist or the dermatologist at the pharmacy to do that. So this is a pretty important signal in the decision-making process. I believe that not only the pandemic, but also the credibility that a dermatologist and a pharmacist have is so strong and powerful that this market cannot but grow. I see the pharmacy as an evolving points of sale. Regulatory evolutions have allowed or helped the pharmacy to look after more innovative business models, and I believe the evolution will be very strong. You said before that 50% of the consumers' decisions are influenced by other more expert people. Will this share increase, or will consumers become more autonomous? Well, we talked about that yesterday. We have an internal lab. We produce projects and prototypes in different countries to try and differentiate our own business model. We are working on a project in the US where there is no doctor present. There's Sofia Vergara, an actress. Because we want to measure, starting from the point that we have a scientific-based product and that is to be reported. We want to see what is the component which is outside the scope of the dermatologist and the pharmacist. I believe there's a great growth expected in this, but what we currently call the bata blanca, that is the white apron in English, well, that is determinant in the final decision. The consumer studies and researches, but I believe that the opinion of the pharmacist or the doctor will always play a major role, even for the newer generations. So you do not see an evolution of your company through traditional communication, always considering the scientific-based product. Will you still stick to those 50% of consumers? Well, this is what we say every day. I believe it is enough, but not only that. So the fact that a professional doctor or pharmacist is important, but we keep on watching that world through the lens of these health experts. The consumers are, however, pretty important. I believe that the development will come true through a clear communication of what the product, the treatment can do. However, keeping an eye on the consumer, because consumers look for information. Do you work with e-commerce? No, we sell to retailers, but we don't have any direct selling. And what about the evolution? You have these products with a strong science base. Are you thinking about additional channels or the pharmacy only forever? That's a good question. We'll always follow our own reference stakeholders, the pharmacist, the dermatologist. But of course, the brand is in the hands of the consumer. So we will always try and support health professionals. But of course, consumers will have to find us where where the product is needed. Of course, the product is
che guarda l'efficacia, quindi qualcuno deve gestirlo.
to be considered within its range of effectiveness. So someone has to explain that. That's a weakness if you consider the general access to purchase. But it's very interesting because there's a content in our products to be told. If you consider the world of pharmacies, I believe there's a whole new evolution within the pharmacy, which is growing and growing. We heard about an interesting project before, and I believe that the pharmacy will be more and more a point for advice because that's the margin for growth currently. I know you have acquired the Lanzin brand a couple of years ago. Are you doing that with them too, or will that follow a different path? That's one of the projects I was telling. Lanzin is not involving health experts. It's a typically consumer product with the pharmacists' support. I understand that these are very trivial stories, but there's so much evolution on the model I've been sharing that we are currently studying a lot. I believe this is the first step, and Lanzil will tell us a part of our future history. You were saying this group is very collaborative with your branches. What are the goals of this company? Because it's large and small at the same time. So, are they based in Spain? Yes, Madrid. Yes, we are from Madrid, of course. Because I want to say that because there are also behavioral and training features that are pretty different. This is no criticism, of course. We love gin tonic at the end, all together, and that's what I usually say. What are the goals? What logics will you follow? 600 million in 5 years. If we consider our aggregated growth, that's going to be part of organic and part of inorganic growth. That's a minimum objective goal for the next 5 years. Italy is going to close at 41, 42 within this year, 80 within 2026. So Italy should wait for about 20%. No negotiations on the weight of the country. Thank you very much for this very interesting success story. And of course, we'll meet again in the next few years on this very same floor. Thank you. Thank you.